Hi, I'm talking today to Counsellor Kathryn Kimbley. Hi, Kathryn, how are you?
I'm well, thank you.
Very good. Kathryn, today we're talking about counselling. What is counselling, and in what areas can you step in and help people?
Counselling is an approach that is used to help people, usually who perhaps have mental health problems or are struggling with issues, personal issues, or who just want to explore their thoughts, feelings and emotions, to process them and to grow from them and develop and perhaps move on from them.
What conditions can you help people with?
There are a whole host of conditions, but you don't have to have a condition to access counselling. Some of the more common conditions that counselling is used for might be depression, bereavement, anger management, low mood, anxiety, even things like to stop smoking, or domestic abuse and violence, alcohol abuse, a whole host of things.
If I was coming to you for depression, firstly, how would I know if I was depressed? What could some of the signs or symptoms be?
Well, depression is different for everybody. Most people will experience some of the symptoms. Some people might experience all of the symptoms that are recognized medically. There is like a category of symptoms that the medical professional will recognize and use to diagnose somebody with depression. I'm not qualified to diagnose somebody with depression. However, if you might be feeling low in mood, or if you've been having a particularly bad time, feeling particularly moody, or just feeling unhappy, or you might be losing weight or putting on weight. It's different for everybody. But the important thing is that if you're experiencing symptoms like this, to actually go and speak to your doctor.
What could I expect to happen in the initial session with you or the sessions that followed thereafter?
The approach that I use is something called person-centered counselling. It's a humanistic therapy approach. What that means is that I will focus on thoughts, feelings and emotions, and we will work with the client to explore those thoughts, feelings and emotions in a safe environment and a confidential environment, so that they can reflect on those, if you like. I will not give the client all the answers. However, I will help them see things from a different perspective, if you like. So I like to explain it to clients as an opportunity to look at those issues from a different perspective. Usually what I say is, have you ever had a thought that you've just been stuck with and gone over and over again in your head and seem to be going nowhere fast? And it's a common thing. Most people at some point in their lives have experienced that. So this is just another way of looking at that thought from a different perspective. And just by shifting the angle, you're moving it and you can start the ball rolling again. And my reflection, what I filter through, what I see, might provide them with enough to keep moving again and to grow from that, and incremental steps, small steps.
What techniques or advice could you give someone to help them cope with depression when they're not actually in the therapy session?
Well, as I said, I won't give somebody the answers. However, there are recognized techniques and approaches that people can use. I like to use an approach called mindfulness-based meditation. So that helps people to live in the moment, to learn to become aware of their bodies, how they're feeling, and to reconnect with themselves, if you like. And in today's society, when we're rushing so much all of the time, to take time out and do that can actually be a very powerful thing. And if they learn to do that, then they can actually take that from the counselling session and use it outside of the counselling session. And that can help the process along as well. Relaxation is really important, and a lot of people don't take time out to do that. Time for me, if you like.
Thank you, Kathryn. Thank you so much for talking to me today.
My pleasure.